You may be asking, who are or and what is People Care? All of you are familiar with LIPA, or the Louisiana Independent Pharmacies Association. People Care is LIPA's partner for this project. It will be handling the administrative duties like getting partners enrolled, providing you with training and ongoing support, and processing the actual payments for services you are to provide. People Care and LIPA share some of the same employees. Names you may be familiar with, like Mr. Johnson, Ruth Kennedy, and Matthew Cross. You'll also see some new names on the project team. This project we will be working on together for the next 14 months through May of 2024 is hugely important. What we do can make the difference. And whether your patients who have Medicaid today continue to have Medicaid or another health insurance like Obamacare a year from now. This is a huge initiative that the Louisiana Department of Health, or LDH, and Medicaid has launched to review the Medicaid eligibility of more than 2 million people. That is more than 43% of Louisiana's population, and that will need to be reviewed by July 1st of 2024. That breaks down to reviewing 8.33% of Louisiana Medicaid enrollees per month to review, or 168,000 people. You may see or hear the term unwind. What is an unwind period? It is a term that the federal Medicaid agency, CMS, gave to the effort that all states will be undertaking to return to normal Medicaid operations after a 3-year period during the pandemic of not doing annual eligibility renewals or redeterminations on Medicaid cases and not closing Medicaid cases unless someone died, moved out of state, or requested closure of their case in writing. The governor, LDH, and Louisiana Medicaid leadership have announced that their goal, and it is our goal as well, to ensure that everyone eligible, being the operative word for the Louisiana Medicaid program, maintains their coverage through the unwind period. Here's a quick overview of the topics we will be covering for today's training. First, we'll recap the basic requirements for being a Medicaid outreach partner. We will then touch briefly on some federal laws and regulations. We'll go through what we're calling the menu of compensable services. That is the outreach and enrollment activities you can perform and in return receive payment to cover your costs for providing them. We'll talk about expectations for record keeping and what you need to do in order to get your invoices paid. And last but not least, we'll talk about the multiple ways you can get help and answers as we move forward. LDH recognizes the value of independent pharmacies and actually reaches out to LIPA early this year and asked how LIPA thought the independent pharmacies could help their Medicaid patients successfully navigate the eligibility renewal process. The most important requirement, which is actually not listed right here, is that our partners be either a Louisiana independent pharmacy, one of the 5 regional food banks in our state, or a food pantry. Most of you who have joined this training have already submitted your online application. We have received 78 applications so far in just 2 weeks. If you have not yet submitted your application, we strongly encourage you to do so as soon as possible. You'll need to agree to the program requirement, a lot like the requirements for being a Medicaid pharmacy provider, and enter into a subcontract with LIPA's partner, People Care. I'll talk more about that process in just a moment. Completion of all training is important. We will need to document that at least one employee in your pharmacy has completed this onboard training prior to providing compensable services, that is, services for which you can receive payment. We will be repeating this training Friday, March 31st during a 12 noon to 1 p.m. lunch and learn. So that makes 2 opportunities to complete the onboard training prior to April 1st, your go live date. Accurate completion of the daily activity log is essential as we need the information you input for our reporting to LDH. We are asking that you submit your monthly invoice no later than the 5th day of the month so that we can meet our monthly deadline for providing a detailed report to LDH. You may be wondering which of your employees can provide the level of outreach and renewal assistance that we are looking for. While it is certainly preferred if the pharmacist, who we know is a highly respected healthcare provider, or a pharmacy tech provides the verbal counseling, other outreach activities can be satisfactorily performed by clerks, as well as the verbal counseling. An understanding of the project goal and genuine desire to help patients who are eligible for Medicaid stay enrolled is important. The LDH Trusted User Qualifications. Trusted users are people who are authorized to do Medicaid eligibility interviews and submit Medicaid applications. That is a good proxy for qualifications for your employees who will be engaging in outreach and renewal activities. Those who are age 18 or above, demonstrating basic computer skills, ability to understand and follow procedures and guidelines, exhibit professionalism, treat Medicaid applicants and recipients with respect, and provide excellent customer service. Our role at People Care is to help you and your employees so that y'all can help your Medicaid patients. You and your employees will have access to daily, robust support and technical assistance from our project team, which includes Medicaid eligibility experts. The contract you will need to sign was sent out Friday evening to the email address you listed on your application for the owner manager. It was one of the last questions on the form. They were sent via DocuSign, which allows you to electronically sign and email the contract back to us. If the owner manager did not receive an email from DocuSign, please check the spam or junk mail folder. We are requesting that you get that contract back to us as quickly as possible so you can begin providing compensable services as early as April 1st. If you have questions about the contract or didn't receive the contract, please reach out to either Matthew Cross or Donaldson Caffrey at the LIPA office. The next 5 slides will cover topics that LDH has agreed to provide training to all of their contractors, and that would be us, and subcontractors, that would be you. This will not be new information for most of you since you are already a healthcare provider for both Medicaid and Medicare, and these things are all addressed in your provider agreements. The first thing we'll cover is what the Federal Office of Inspector General defines as covered persons and making sure they have not been disqualified. The purpose of this policy is to keep so-called bad actors from getting Medicaid or Medicare dollars. As a Medicaid contractor or subcontractor, you are considered to be a covered person, but then you already a covered person as you already are as a Medicaid or Medicare provider. Covered persons include contractors, subcontractors, agents, or other persons who furnish patient care items or services on behalf of LDH. The OIG has established an exclusion list of people not allowed to receive money from federal health programs, people convicted of Medicaid or Medicare fraud, patient abuse, other healthcare fraud, and controlled substance violations. Our contract with LDH requires us to check the names of all of our subcontractors every month to see if they have been added to the list and document that we did so. You may click on the link OIG exclusion list and search for your own name. The list includes many thousands of names. Because of the lag time between a conviction and when someone's name is actually added to the list, the OIG requires immediate reporting, and we are defining immediately as within 24 hours if you are convicted of certain crimes. You can click on the blue Certain Crimes link on the slide to see what those are. Next is the federal anti-kickback statute that basically prohibits pay to play in the business of federal health care, including Medicaid. The Federal Stark Act, or Stark Law, was enacted in 1989, and while doctors' groups have lobbied for changes to it, it remains unchanged almost 35 years later. This law applies only to physicians and prohibits them from referring their Medicare or Medicaid patients to another provider, like a lab or home health agency that they or their immediate family member owns. The OIG and LDA require that we make you aware of the Stark Law. Moving on to the False Claims Act, unlike the Stark Law, it does apply to this project since our contract is primarily funded with federal Medicaid administrative dollars. The FCA prohibits anyone from submitting false or fraudulent claims to Medicare or Medicaid, and this includes things like falsifying invoices. The False Claims Act is sometimes referred to as the Lincoln Law. It was originally passed during President Abraham Lincoln's administration in 1863 in response to unscrupulous contractors cheating the government during the Civil War. Finally, Medicaid outreach project partners must report suspected fraud related to this initiative, and there are multiple pathways for doing so, which you can see here. You can remain anonymous, and you do not have to give your name. As Medicaid providers, you have already agreed to keep information about your Medicaid patients confidential. This includes name and address, medical service provided, social and economic conditions, any and all medical data, and information received for verifying income eligibility. The bottom line is to limit discussion of Medicaid members or applicants in the workplace to a need to know, and don't leave their information laying around or up on the computer screens for others to see. Pharmacies have been covered entities for HIPAA privacy purposes for the last 20 years or so when the law became effective, so you are very familiar with the HIPAA requirements. People Care is a business associate of LDH as defined in HIPAA, and partners are considered our business associate for HIPAA purposes. Your contract included as an addendum the HIPAA Business Associate addendum. Moving on now to discussion of the outreach activities that partners can engage in and be paid for. We requested feedback from the pharmacies and developed a menu of outreach and enrollment services that our partners can realistically provide. Hopefully, you have seen the one-page compensation menu, which contains 14 different activities and the compensation amount for each. We'll now look at some of those in a little more depth. First on the list is displaying outreach signage in your patient waiting area or other prominent location where it will be seen. Initially, we will be providing partners who want to display the LDH designed sign with signs in a freestanding acrylic holder. The payment for displaying signage is $50 per month, including a partial month if you receive it after the first. We also plan to offer larger signs and easels. We have received acrylic holders, and the signs will be available in your first delivery of materials. You can get compensation for text messages sent to your Medicaid patients, which you should be able to identify from your pharmacy software system. We have received approval from LDH for wording of a text message that you can begin getting ready to send out. The actual language will be in a document posted in the partners area of the web page, and we will also be emailing it to the mail group we have set up in Outlook. By the way, more than one person from your location may be included in the mail group to receive information. please let Ruth know, and you can email her at kennedy@peoplecarela.com to request to be added. You may send out a batch text to Medicaid patients if you have software that allows you to do this. Because this could be hundreds or even thousands to text or for batch text, you will not need to list the first and last name of each patient on the daily activity log. Compensation for text messages is 25 cents per text. You can invoice for one text sent per patient per month at this time. We expect wording will change for future months. The next activity is distributing various printed outreach materials designed and approved by LDH to your Medicaid patients. The materials will include we have 8.5 by 11-inch flyers, 4.5 by 5 or half sheet bag stuffers, little 3 by 5 push cards. That's what they're called in the industry, and they have print on the front and the back. If you want to distribute printed materials and have not placed your order online yet, please do so immediately. We will be making the first deliveries of printed outreach materials beginning the last part of this week, most of them in person. We will call the primary contact to let them know the day and time window. For each piece of printed outreach material that you invoice for, the compensation is 25 cents per piece. You'll need to record the patient's first and last name, along with date and name of the employee on the daily activity log. We expect to have different messages and materials available as the project continues. One word of caution. LDH is very particular about these printed materials and have specifications for the type and weight of paper they are printed on, the dimensions, and so forth. They have stressed that under no circumstances should black and white copies of their materials be distributed by their contractors. Again, we're urging you to place your online order for printed materials now. In addition to the LDH created written materials, we have several additional items available for ordering. You may request a vinyl banner. We have 2 different sizes, or a yard sign with a stake that says Medicaid Renewal Assistance available here. You can also request a self-inking stamp with your location name and phone number to call for renewal information that you can use to stamp your printed materials. We know some of you need materials in Vietnamese or Spanish. Please specify on the online order form the language and number or indicate a percentage breakdown, like, for example, 60% English, 30% Vietnamese, 10% Spanish. The next service is one that we think is especially important. That is the verbal counseling, or having your conversation with your Medicaid patients regarding the return of eligibility renewals and what they need to do to keep their Medicaid case from getting closed, even though they are still eligible. A suggested script was emailed this past week and can be downloaded from the PeopleCare website. You can modify the script to put it in your own voice and to meet the needs of the Medicaid patient. It is not meant to be read word for word and meant to be as a conversation type guide. Verbal counseling will need to be documented in the daily activity log. Compensation for verbal counseling is $6 and can be billed once per patient per quarter. The script will likely change going forward as we learn more about what resonates. In advance of mailing out the first batch of renewal notices, LDH has been focusing on trying to get current contact information, most importantly, a good mailing address to mail the renewal letter to. When we talk about changes, the last contract LDH had with most Medicaid members is at least 3 years ago when the pandemic started and up to 4 years ago, possibly. LDH places value on having not only good mailing addresses, but also both landline and cell phone numbers, as well as email addresses. There are many ways Medicaid members can report updates to their contact information, but two ways at this time that you can facilitate the update and receive 750. The easiest is to complete a contact information form and either fax, scan, or email to LDH. For those of you who become satellite Medicaid application centers, your trusted users can make the update directly into the Medicaid eligibility enrollment portal. The pink letters. While we're talking about having good contact information for Medicaid members, Medicaid pink letters are back. During March, LDH sent out pink letters again in an effort to get a good mailing address. You may recall pink letters were first mailed out last year, and then eligibility renewals did not begin when anticipated because the public health emergency kept getting extended. You can, as part of your verbal counseling script, ask your Medicaid patients after April 1st if they received a pink letter from Medicaid in the last few weeks. If they say no, consider that a red flag to question address. Keep in mind that you can view the mailing address Medicaid has on file in MEMVS that you can use to check Medicaid eligibility. Another service you can provide is to help Medicaid patients who you believe to be capable to using Medicaid eligibility enrollment, or E&E, self-service portal to complete their renewal, report changes, and even complete and submit a new application. We know that not all Medicaid patients have internet access or the degree of a computer savvy that is necessary to do this, but a substantial number do. The first hurdle is setting up the account and getting the necessary sign-on credentials. Medicaid members will need an email address, and they may have never had one, or if they do, they don't remember it. If they don't have one, you can help them set one up through a free email service like Gmail or Outlook. You can then go to the patient portal and help them set up a user ID and password or retrieve theirs if they have forgotten it. We have wallet cards, which you can order using material order form to complete and give the Medicaid member with their email, user ID, and password that they will need to use the self-service portal. Compensation for providing the member with this assistance is $5. While it is not mandatory, we strongly encourage you to enroll with Louisiana Medicaid as a satellite Medicaid application center. There is a one-time payment of $150 for doing so to compensate for the time it takes to complete the enrollment and online training. Once you receive confirmation that you have been enrolled and your location number, you and your employees can enroll as Medicaid trusted users. The one-time payment for each Medicaid trusted user is $75. Trusted users will need to complete the LDH online training. The advantage with being a Medicaid application center is that your trusted users will be able to submit information through the Medicaid online partner portal, and you will have access to case status information that is otherwise not available to you. Several of the services on the menu can only be provided if you were Medicaid applications, and you can see those here. That includes submitting a case change through the E&E partner portal, for which compensation is $750. Submitting a renewal through the partner portal, for which compensation is $25. And submitting an initial application through the partner portal, for which compensation is $30. You may also receive compensation for sharing Louisiana Medicaid's Facebook post on your pharmacy's Facebook page. Compensation is $25 per shared post, up to 4 per month at this time. On your daily activity log, please include the Facebook page name the post was shared on in the comments column. You can view Medicaid Facebook page at the link above, and their most recent post is about the pink letters. Finally, You may receive a $20 monthly stipend toward the communication charges for personal cell phones, tablets, and laptops used in outreach. On the daily activity log, include the name of employee in the comments and what device is being claimed for and the phone number if applicable. I've mentioned the daily activity log a lot, so let me explain what it is. The daily activity log is an Excel spreadsheet that you will be able to document all of the activities that you will submit an invoice for. We have worked to make completing the form as painless as possible, but we recognize that it will require time and attention, and we have built that into the rates. The form will be online, and each partner will be provided with the link to their location's form. You'll actually have two work pages, one to document general activities, that is, activities not specific to a particular Medicaid member, and one which will, for most of you, have many more rows, is the member-specific worksheet, where you will input along with the date and activity from a drop-down box, the first and last name of the Medicaid member, as well as the name of employee who completed the activity. We learned a thing or two about the online forms during the Shots for 100 project. For the gift card project, each participating pharmacy completed an online form daily, as you will recall. Here are our top 4 lessons learned. First and foremost, make sure you are entering your information into the online form and not one you have downloaded and saved on your computer. Please complete all of the fields. We are asking only for what we need to know. Watch for duplicates and please delete any duplicates that you might see. And finally, enter the information on your activities daily. Have more than one employee that is knowledgeable about completing the form. We will be skimming the forms daily, and if we see no data being entered or there errors, we'll reach out to the primary contact. The most important thing about your invoice is that it needs to be submitted no later than the 5th day of the month. That will be May 5th for activities between April 1st and April 30th. The good news is that the data you need to prepare the invoice can be found on your monthly activity log. Your project monitor will first receive and review the invoice. We will be assigning each of you a project monitor from our team and let you know if they see information missing. The invoice will then go to our contracting officer, Glenda Lindsay, for review and final sign-off. Checks will then be processed promptly by PeopleCare and mailed to the address on your invoice. Just to confirm, your check will come from PeopleCare and not directly from LDH. We want you to know that we have created multiple ways for you and your employees to get help. Each partner will be assigned to one of our project teams who will be your primary contact. They may not know an answer, but we will know where to get the answer and we will get back with you promptly. Most of you are familiar with GroupMe chat groups. Our new PeopleCare website is now live and it includes a partners only area. Our PeopleCare outreach helpline is now up and running. We are committed to providing you training resources throughout the project. Our project website just went live this morning, and it includes a special password protected area with resources for you, including the compensation menu, the link to the materials order form, the copies of the training materials, such as the PowerPoint slide deck that you are viewing now. Here you can see the step-by-step instructions for getting your password. If you are signing on from a mobile phone rather than a computer, you may click the 3 bars, then on Partner Login, click on the 3 bars on the right side below the blue banner. Click on Partner Login above the PeopleCare logo. Complete all fields, including the I am not a robot checkbox. You will get an email asking you to confirm your email. Otherwise, the system doesn't know whether you're a person or a robot. If you need help getting your password, please contact Ruth Kennedy. Her contact information will be on the last slide. We will be setting up a GroupMe chat group this week. If you're not already using GroupMe, you can download the free application to your phone. GroupMe is an amazing tool for providing rapid response answers to questions, sharing promising practices and tips, and a way to interact with peers. We will be posting announcements and links and sharing documents, for example, approved text messages in the chat group. To add yourself and employees, all you need to do is email Whitney at the address you see on the screen with each employee's name and cell phone number. Our Medicaid Outreach and Renewal Call Center is up and running Monday through Friday between 8 a.m. and 6 p.m. The call center is located in the LIPA office in Baton Rouge. As with project monitors, we don't know the answer. We will tell you that. If we don't know it, we do know where to get the answer, and we will get it for you, and we will call you immediately. You can expect continued training opportunities throughout the project. We are currently planning training on LDH's expectations for Medicaid application systems and health insurance options like subsidized insurance through the federal marketplace, sometimes referred to as Obamacare, for people who are no longer eligible for Medicaid because their income is over the limit. Training resources will be posted in the partners section of the website for either viewing or downloading. Please let us know those areas you'd like to see more training in, and you can email me at the address on the screen. And with that, Louisiana, get on the phone. We're ready to address all of your questions. Our project director, Ms. Ruth Kennedy, is here, and she will be answering the questions that you might have. You may ask them now, or email, text, or even call later. At this time, we're going to open up the chat, and Miss Ruth, come on board.
So do we have any questions that were typed into the chat, Whitney? If not, I think all the mics are unmuted, and it's only about 50 people, so you can go ahead and ask your question.
No questions in the chat just yet.
Okay. And again, we have a Q&A document. I couldn't call it frequently asked because they hadn't been asked yet, but I did anticipate them. Those were my anticipated Q&A. And so we're going to any questions that I get from you, either by email or phone or text. And when I answer those questions, I'm going to add them. And the current version, I'll update it and upload to the partners only area of the website. I encourage you to go ahead and get set up. Click on that little icon at peoplecarela.com to get your login information for that partner only area. That's going to be your one-stop shop for documents, links. We are right now doing logistical planning to now, if you're not asking a question, you can mute yourself because I hear some background noise. But we are planning to start delivering materials. We have them ordered from professional printers. I urge you again to get those orders placed. And if you don't need the link, shoot me an email. If you don't have the link or can't find it, shoot me an email and I will send it back to you. Both the link and a QR code that you can scan. But from the website and the partners area, you can go straight to click on a link that takes you straight to the form.
Hey, Miss Ruth, this is Wanda, and I had to mute myself because I'm at work. Is there a way that we can, is there a repeat of this broadcast other than the one coming up on Friday?
Um, we have a recording of it. We've recorded it. So
Okay.
if you feel that it would be helpful to get a copy of the recording, we can post that on the website, Wanda.
I would appreciate that. Thank you.
Okay, thank you for that, that request, and the slides will be posted there. The version I have right now is without the notes, Natalie's notes, but if you think it would help for others in your pharmacy to read those notes and not just the slides themselves, we can post the version with the notes as well.
Thank you.
Other questions or comments or requests?
Yeah, this is Michelle with James Drugstore. Can we actually get the notes with it, Miss Natalie's notes included in those slides? I think that would be really helpful.
Yes, I will. I will send the version that has all of the notes in, so that you will have those available. That information.
Thank you. I appreciate it.
And you are our eyes and ears on the ground, and we highly value your feedback, what's working, what's not working with this. So we will be making just adjustments, rapid response mode we want to be in, but let us know any suggestions for improvement. In fact, one of the things that we've added, the opportunity to get a vinyl banner or a yard sign that says, with a stake that says renewal assistance available here, or the stamp materials came from one of our partners. So we value your ideas and feedback, whether it's messages. LDH offered to us that if we have specific messages that we would like to see in printed materials, that they will work with their contractor for printed materials that's going to be on board soon. One of the things I was thinking that pharmacies could do as part of verbal counseling, or some of that messaging, is saying that if your case gets closed, the amount that you would be responsible for paying for your prescriptions is whatever, that may get people's attention. So again, if you have not submitted the application online yet, that means that with two exceptions who I have talked to, you have not gotten the contract. So please go ahead. There's some important information on that form. You name your primary contact there, and who the owner manager is that the contract should go to. Also, we ask for your days that you're open and times is we're actually on our website. We have a map that shows the locations where renewal assistance is available. We'll have one color for pharmacies and another color dot on the map for the food banks and food pantries. And that includes days. If there's a number phone number that you want to update or to go to a specific person because it's renewal related, let us know that. But we have multiple people here on the team that will be, and we can make those kinds of changes rapidly. That's our commitment. Does anyone have anything else? Going once? Yes.
This is Trina with Caraway's Pharmacy in Westlake. I have a question regarding the becoming an application center.
Uh-huh.
Is there, what all would be involved? Do you have to have like a special room or anything like that available for any kind of
There,
special setup to do that?
the requirement does say there needs to be an area, where there can be a confidential interview. It
Okay,
doesn't say there has to be a special room, but there has to be some it has to be a confidential area. It could be a screen. It doesn't have to be four solid walls. You could even maybe do a screen area with a screen.
okay, thank you.
Portable screen is an idea for that.
Okay,
A
thank you.
table and 2 chairs, a card table and 2 chairs. It wouldn't be that expensive to set up. Other questions? Again, feel free to email, to text, to phone, and I'll get back with you. And so with that, I think I'm going to give you back 19 minutes of your afternoon since I'm showing 3:41. Bye, everyone, and we look forward to working with you on this project. As a former Medicaid eligibility a person in Louisiana, outreach person, this is a project that is near and dear to my heart. So I personally embrace the goal of making sure that eligible people don't fall through the cracks just because of the red tape involved in renewing their Medicaid eligibility. Good afternoon. Bye-bye.
Thank you, Ms. Ruth.
Thank you.
Goodbye.
Thank you. Thanks very much, Ms. Ruth, and the rest of your team. Thank you very much.
Thank you all.